Happy New Year to everyone out there. I'm Amelia McGovern. We begin today with a major change to the Affordable Care Act that's really hitting millions of Americans, especially in their wallets. Pandemic-era subsidies have now ended, and for about 4 million Texans, that means higher health insurance costs. Nicole Nielsen takes a closer look.
For Richard Hernandez, a mechanic in Keller, rising health insurance costs aren't just numbers on paper. They can be life or death.
I have had cancer twice.
A two-time cancer survivor, he struggled to find insurance because of pre-existing conditions. For years, he paid out of pocket until he enrolled in coverage through the Affordable Care Act in 2022. Not because it was cheap, but because it was available to him. Even then, the cost was high until this letter arrived.
So I received this October 31st of 2025.
The notice detailed a sharp increase in his monthly premium from about $900 a month to almost $2,300 a month starting January 1st, a 156% increase. He says it just isn't doable.
Totally unaffordable.
This is the reality for many across North Texas who don't get health insurance through their jobs. With these subsidies ending, they're left with little to no options at all.
So I dropped it. November was my last payment for insurance. I figured why pay them $900? For nothing.
He's one of many. A study from Texas A&M University shows somewhere between 665,000 and 1.45 million Texans may no longer be able to afford their insurance premiums.
We have about 4 million Texans that rely on that coverage. And, these are gig workers. These are small business folks. These are early retirees.
Texas already has one of the highest uninsured rates in the country. Experts say with costs now climbing, many freelancers, small business owners, and people working in trades may be forced to choose between health insurance and basic living expenses, with some seeing premiums double, triple, or more.
Older couples that say in their early 60s, making $82,000 a year, they're actually going to see an $18,000 increase in their annual health insurance premiums.
And it has ripple effects on the whole healthcare system.
People may delay care. It means people may come to the emergency room to get primary care services, which is going to cause overcrowding.
For now, Hernandez is doing what he can, paying cash and hoping nothing goes wrong.
So I'm gambling until I'm old enough to get on Medicare, and hopefully nothing will happen.
In Keller, Nicole Nielsen, CBS News, Texas.
And so with all this said, you may be asking yourself, what's next? The House is scheduled to vote sometime this month on a 3-year extension of tax credits. However, the fate of those tax credits is unknown in the Senate after senators rejected a similar plan last year.